Moving on to other news now. Ladies and gentlemen, urban India is dealing with a silent killer which thrives in the very air we breathe. It is invisible to the naked eye. It can't be filtered out by our lungs and kills as many as 33,000 people in just 10 Indian cities every year. A study conducted by the Lancet Health Journal across these 10 cities, which includes the 6 metros as well as Ahmedabad, Pune, Banaras and Shimla, has shown alarming levels of PM 2.5 in the atmosphere. Now, according to the study, Delhi has the highest fraction of daily and yearly deaths attributable to PM 2.5 air pollution, which comprises particles 2.5 micrometers or less in diameter. Annually, the national capital records around 12,000 deaths linked to air pollution, amounting to a staggering 11.5% of its total deaths in a year. The study has also highlighted that the casual effects were particularly strong in cities with lower overall air pollution levels, such as Bangalore, Chennai, and even Shimla. The research, which is the first multi-city time series analysis of short-term exposure to PM 2.5 and daily mortality in India, analyzed around 36 lakh daily deaths across 10 Indian cities from 2008 to 2019. According to the study, the levels of PM 2.5 tiny pollutants that can penetrate deep into our lungs and bloodstream exceeded the World Health Organization's safe limits on 99.8% of the days. Now, PM 2.5 particles cause severe health issues, including respiratory and cardiovascular diseases. Inhaling these particles can lead to respiratory problems such as coughing, wheezing, aggravated asthma, bronchitis, reduced lung infection, not to mention cardiovascular disease and possibly cancer as well. Even short-term exposure to PM 2.5 has been seen to have harmful effects. Let me go across to Pornima Prabhakaran, who is director at chart at the Ashoka University. She's amongst the researchers who's worked on that Lancet report. Dr. Prabhakaran, thank you very much for your time here on Mirror Now. My first question to you is a simple one. What was the casual trigger for your team to look into potentially fatal effects of PM 2.5 in Indian cities?
Well, first of all, thank you for your interest in this report. For people living, especially in the Delhi NCR region or in the northern parts of India, this is no news that air pollution has become drawing room conversation. It is an issue that has become relevant in not just daily lives but also in the governance structures, because it has become a area for discussion both at governance levels but also because of its impacts on public health. And I think for the longest time we thought of air pollution as an issue which was very, something that required to be addressed from very different lenses. But increasingly we have recognized that it has impacts on health, on lives and livelihoods. And as people working in public health, as academic researchers, it has become imperative for us to turn our attention to this. And earlier, the evidence in India was scarce, and the question was being asked even in the higher levels of the government about where is the homegrown evidence, where is the evidence in India. So since 2016, actually till 2016, there wasn't that much that was happening in the air pollution research space. But 2016, if you recall, was the year that we call the apocalypse year for Delhi. It was the worst air pollution episode that we had seen. And it was very timely that our group had just then, had the good fortune to get funding to kind of start looking at this very, very topical issue. And we started our journey there, and I think we were looking to fill the gaps for India.
Okay, a simple question here. What makes PM 2.5 a silent killer? How is it different and more lethal than, say, a PM 10?
So let me start from the very basics. So when we talk about air pollution, what are the constituent pollutants in the air? They could be gaseous, they could be a mixture of heavy metals, and they could be these particle pollutants. And among the particle pollutants, you are right, you have the slightly bigger constituents, the particulate matter 10. When we say PM10, it's the size of the particle, so microns. So PM10 is 10 microns. But PM2.5 is the smaller culprit pollutant because this pollutant is able to kind of go down to the deepest levels of our lungs when we inhale the air pollution, polluted air. And they're able to cross what we call the blood barriers and enter into what was known in medical parlance as the systemic circulation. This very fine particle is able to therefore penetrate into every organ system that you can think of. And therefore, intuitively in the past, while we thought poor quality air means impacts on respiratory health, on our lung health, and we will have exacerbated respiratory illnesses. Increasingly, we are recognizing, and the evidence has grown even in our own research the arena in India, that the effects are very widespread on multiple organs, on cardiovascular disease, on the brain, stroke, for example, peripheral vascular disease, but also, if pregnant women are exposed to adverse air quality levels, they can have adverse birth outcomes. So,
Okay.
low birth weight, stillbirths. So increasingly, the evidence is coming out not just every other parts of the world, but also now in India. So this is the finer particle that has disastrous health consequences. There's an even finer particle, the PM1, the point 0.1 microns in size, but this one is easily measured by all the monitoring.
Now, what's quite alarming in your report, Doctor, is the potentially fatal levels of pollution, not just in big cities like Delhi that we have mentioned, and a city that constantly makes headlines, but also hill stations like Shimla, places you generally will not associate with conventional pollution.
You're right. I mean, I think you probably are aware that the World Health Organization actually has the guidelines at a very much lower level as compared to our own national ambient air quality standards. Whether it's for the daily exposure to PM2.5, which they set at 60 micrograms per level, and the annual exposure at 40 micrograms, while WHO it is 15 and 5. So already, I think our air quality standards are high, but even within cities like Shimla, you took the example of Shimla, but also other cities like Chennai and Hyderabad, Bangalore, which have air quality levels well within our national ambient air quality standards, the findings were quite stark. We saw that the relative risk of dying, the risk of dying was higher even at those lower concentrations. It just goes to show that, I mean, those are probably it is what it is. We have to probably revisit our air quality standards because we have a tendency to kind of focus on the cities that are not conforming to the national air quality standards, cities like Delhi that are always in the news because we far exceed the national air quality standards. But this study points to the very startling fact that even at lower concentrations, the risk is steep actually at the lower levels. And I think it calls to attention revisiting our air quality management strategies, and our focus also has to change. The National Clean Air Program, for example, focuses on what we call our non-attainment cities, the 130 odd non-attainment cities that aim to reach the standards that we have. But here here is the study that is showing us that even the other cities are to be brought into our radar.
Ms. Prabhakaran, thank you very much for your study and thank you very much for your time as well here on Mirror Now. Good to have you on the show. Thanks.